The National Health Insurance Act, what does it mean for you as a South African? What does it mean for the South African healthcare industry, both private and public? And ultimately, what does it mean for the growing role of the government in your life, specifically in health facilities? My name is Makone Maja, and on today's debrief with the IRR, we are breaking down the consequences and the possible ramifications of the implementation of the National Health Insurance Act. So you have noticed that Dr. Aaron Motsoaledi has returned to his position as the Minister of Health and has indicated that he will be pursuing the objectives of the NHI by hook or by crook. But what exactly are those objectives of the National Health Insurance? The goal is to make health insurance equitably accessible so that everyone in South Africa is covered by a medical aid or medical insurance that is administered from the top, from the government, instead of the system that we currently have, where you have various companies competing and bidding for your customer and your money as a customer to provide medical aid to. The NHI proposes doing away with that and having the government be the one to administer health insurance. Now, the government argues that that's not their goal and that individuals will still be able to obtain medical aids, but that's effectively what the NHI is going to do. It's going to grab all the money that is your individual contributions to your medical aid. It's going to collapse them into a single pool of funds that's going to be distributed across all South Africans. Now, that may sound noble, the idea of a universal health coverage in the form of an NHI, because there are various models of universal health coverage, of which we have one where if you live in South Africa, you can virtually walk into any public hospital and should, in theory, receive access to healthcare. That is not always what happens. However, the NHI is looking to ensure that you are guaranteed access to health insurance. Now, there are various issues with that, and one that I can think of is the outcomes and the consequences of such a policy of placing all eggs into this one basket, of having the government have a monopoly over health insurance. And this is one where, when I think of the NHI, it's weighing whether we should be judging policy by its intentions or by its consequences. And I want to pose a question to you as you're watching. How are you judging the NHI? Are you looking at its goals, which is to make or increase or improve the standard of living in South Africa by making sure that everyone has access to health insurance? Or are you judging it by its potential ramifications, which, if you've been living in South Africa over the past 30 years, corruption is a big reality. Will the funds of the NHI be ring-fenced so that that money is spent strictly on health insurance, on improving health facilities? Will that money be safeguarded against malfeasance and wastage and corruption? Are these just naysayers, the people that are putting forth these concerns? Are these just naysayers, or does South Africa have a history of malfeasance and corruption and waste and management? Well, I think the Auditor General has been doing some great work on this. I'll speak specifically on the issue of wastage. If you look at the national and provincial audit outcomes that were conducted on South Africa's health departments, the AGSA found that about 68.1 billion medical negligence claims had been made against the health sector. 68 billion. Can you imagine how many hospitals that would build? How much more improvement there would be to health facilities if that money was dedicated to again refurbishing some of the most dilapidated hospitals that we have in the country. And in fact, there have been certain reports that have indicated that whilst there are medical negligence claims, sometimes they consume and supersede entire health provincial departments, such as in the Eastern Cape. Right? So that is what I would argue we should be judging the NHI against, is the current state of the version of universal health coverage that we have. And even against its potential unintended consequences, you have to consider the South African taxpayer base. Where will the revenue to support the carrying out of the NHI emerge? This is a question that has been posed to Minister Motsoaledi previously. And during the drafting of the white paper, he proposed that that was, open quote, the wrong approach, close quote. It is the wrong approach to ask questions about where the money that is required to implement the NHI will come from. I would argue that that is a statement that only a government official can make, because in our individual lives and even in our companies and our businesses, we're constantly weighing up costs, right? We're doing what economists call the opportunity cost. You're weighing up, if I give up this, is it worth risking everything else in order to pursue this one objective? And the issue of taxpayers and us not having an economy that's been growing sufficiently enough to provide adequate revenue sources for the government to funnel into the NHI is a reality that must be confronted. In fact, if you look at a lot of the Auditor General reports, including this one about the national and provincial health departments, they're constantly mentioning the issue of poor planning and poor management and poor coordination across departments, because not only are goals poorly defined, but things such as where the money to fund those objectives will emerge are also not stipulated. And so how do you keep such a public health official accountable? But back to the issue of a thinning tax base that hasn't been growing as an issue that must be confronted with respect to the NHI. If you look at South Africa's revenues, right, we have about 989,000 taxpayers, so about 1 million taxpayers who are contributing to 70% of all personal income tax in South Africa. A population of some 64 million, with only 1 million of those individuals contributing to over 70% of all personal income taxes. That is a huge, huge chunk of taxpayers coming from a very small group of people. Now, what will happen when we place those people's access and right to medical health insurance under the risk of the NHI? As I've already indicated, health departments are in bad financial health, but they're also in bad health in terms of adhering to safety and regulation and compliance standards. Right? Take a look at this report from the Office of Health Standards and Compliance. They performed an annual inspection report. Their latest one was from the year 2021 to 2022. And what they found there is abhorrent. They reported that of all the audited health facilities, public hospitals, from clinics to district hospitals to regional hospitals, this audit was performed across all 9 provinces. It included 544 public hospitals. Of those 544, only 178 were found to be in compliance with health safety standards and regulations. That is about 33% of all of those 544 public hospitals complying and adhering to health and safety standards on how they should keep you safe. And to imagine that that very small tax base, those some 1 million taxpayers who are contributing to 72% of all personal income taxes in South Africa, will put up with going to these sort of infrastructure that we have in place for health, as has been reflected in the compliance rate. I mean, I think it's not hard to imagine that that would lead to an exodus, or certainly those top taxpayers considering leaving South Africa over their health being placed in such grave risk of interfacing with the very low standards that are there in public institutions, public health institutions. And it's not just for those. These concerns are not just over those taxpayers. They're over all South Africans at large. If you have health departments that are constantly bleeding money in medical liabilities, shouldn't the government ensure that, first of all, we get our health institutions up to the standard that is required, a standard that they themselves have set, a standard that will ensure that you and I can walk into any public health facility and get quality access to medical health care? Shouldn't we be looking at fixing those very base level core fundamental issues that are missing from our public health sector before we dream up ways of increasing that bureaucracy enormously, right? And confiscating people's medical aids in order to pursue and ensure that that dream is materialized. Ultimately, I think there's a strong case to be made here that we as a country, instead of tending to the issues that we have, tend to abandon those issues entirely and look for other problems to solve, or rather look for other areas in which to create problems, which is exactly what is going to happen if you let the government confiscate, and I would argue expropriate, your medical aids. So that is my take on the NHI. I think there are a lot of things that could definitely lead to the destruction of the health sector, but could also cause a brain drain, not just of medical health professionals, but of those top taxpayers who I have no doubt occupy mid to high level management positions in South Africa's private sector or public sector as well. And that to lose the quality, the human capital, to lose it over the NHI when there's so much that could be done to improve the standard of public health services in South Africa before getting to the goal of the NHI, when there's so much that can be done to grow the economy so that people are able to obtain their own medical aids, when there's so much that can be done by the government to ensure that there are low cost benefit options which have been blocked for years by various government entities. I think we do have our work cut out for us in ensuring that South Africans get access to good quality healthcare. But the way to do that is not to ensure that everyone is more worse off, which is eventually and essentially what will happen under the NHI. And that's it for today's debriefing on the National Health Insurance Act. Let me know what you think. How are you judging the policy? I think ultimately it will come down to whether you're judging it on its potential ramifications, on the history of the version of universal health coverage that we have, or if you're judging it on its intentions, which I concede are very noble, and we should aim to ensuring that South Africa gets people access to healthcare as a basic and fundamental right. Thank you for joining us, and we will see you next time.